Cervical cancer is a significant yet preventable health concern, claiming the lives of many women globally. In response, the World Health Organization launched its global strategy for the elimination of cervical cancer in 2020. This strategy outlines 3 key targets to be achieved by 2030 for countries to be on track towards achieving elimination. This includes widespread HPV vaccination, increased cervical cancer screening with high-performance screening tests, and timely and appropriate treatment for women with cervical disease. These efforts are crucial because cervical cancer is the 4th most common cancer in women worldwide, and sadly the leading cause of cancer deaths among women in South Africa. This highlights the urgent need for better early detection and prevention strategies. So while we've made progress by shifting from cell-based screening to HPV DNA testing, HPV DNA screening alone isn't always precise enough to identify women who are truly at risk of developing cervical disease. Some women may require treatment without further testing, while others need additional evaluation to determine whether follow-up care or treatment is necessary. This is where my PhD research on DNA methylation comes into play. DNA methylation testing stands out because unlike traditional methods that look for abnormal cells, it targets changes in the DNA that occur earlier in the disease process. These changes can help detect HPV-associated cervical abnormalities that are more likely to progress to cancer. By identifying these early molecular changes, DNA methylation testing provides a more accurate way to prioritize care for women at a greater risk of cervical cancer. This is especially important in settings where access to timely treatment and follow-up care is limited. Through my research, we explore the potential of DNA methylation testing to enhance HPV DNA-based cervical cancer screening programs, particularly for women living with HIV who face an even greater risk of persistent HPV infections and cervical cancer. However, while the test shows promise, further work is needed to determine its suitability for routine cervical cancer screening. With continued research and innovation, tools like DNA methylation testing could play a critical role in achieving the WHO's global targets. Imagine if South Africa could lead the way and become one of the first countries to eliminate cervical cancer. I truly believe in a future where South Africa is free from this devastating disease, a future where no woman has to lose a life to cervical cancer. Together, through innovation and dedication, we can make this vision a reality and create a brighter, healthier future for all women.